Right, let's talk about ADHD, because let's be honest, it's a bit like trying to herd caffeinated squirrels, isn't it? If you're a parent of a child with ADHD, you know exactly what I mean. It's not just about a bit of extra energy, it's about focus, impulsivity, and navigating a world that often isn't built for these wonderful, wired-up minds. And that's where CBT, or cognitive behavioral therapy, comes in. CBT doesn't cure ADHD, but it does teach children skills to manage it. Skills that actually stick, unlike medication, which only works while you take it. So today I'm going to walk you through how CBT can help kids with ADHD thrive, how you can use it at home, and why it's worth considering as part of your parenting toolkit. Before we dive in, if you're new here, I'm Emma, parenting expert mom and your guide to raising happy, confident kids. On Raising Stars, we share practical, research-backed tips for calmer, more connected parenting. So, if that sounds good to you, hit that subscribe button, give us a like, and let's get started. First things first, there are two main types of behavioral interventions that can really help kids with ADHD. One focuses on keeping them organized and on task, and the other helps reduce disruptive behaviors. You know, the ones that turn your home into an emotional roller coaster. Now, these interventions won't make ADHD disappear, but they do give kids practical strategies to manage their challenges. Some children do best with therapy and medication, while others find that behavioral therapy alone is enough to make a real difference. The key is that the skills they learn in therapy will help them for life, while medication stops working once it's out of their system. One of the most effective tools for helping kids with ADHD is parent training. And no, this isn't because parents are doing it wrong. It's because ADHD kids need very specific types of support. Parent training helps you learn how to encourage positive behavior while reducing the exhausting battles. There are a few evidence-based programs like parent-child interaction therapy, parent management training, and the Triple P program. These teach parents how to use positive reinforcement, set clear expectations, and provide consistent consequences without endless nagging or shouting matches. And trust me, when used consistently, this can turn a household full of conflict into one that actually feels peaceful. Many kids with ADHD hear "stop that" or "no" all day long, so structured, positive attention can be incredibly motivating. It's not uncommon for kids who've struggled socially or academically to show dramatic improvements with this kind of intervention. Now let's talk about school. Because let's face it, classrooms are not designed for kids with ADHD. But the good news, simple, structured strategies can help, like the daily report card. Here's how it works. Teachers set a few key behavior goals, like staying in their seat, finishing tasks, or not interrupting. The child gets feedback throughout the day, and if they hit their targets, they earn a reward at home. It's like a loyalty card for good behavior, small wins leading to big results. At home, checklists and visual reminders can help. Kids with ADHD often struggle with executive functioning, so breaking tasks into small, clear steps makes things much easier. Timers, planners, and rewards charts are also game changers for keeping them on track. Another key part of CBT for ADHD is teaching skills to manage attention and organization. Remembered ADHD kids often struggle with executive functioning, things like planning, managing time, and controlling impulses. A learning specialist or therapist can help them practice strategies like checklists for morning routines, homework, and bedtimer, because remembering all the steps can be tough. Time limits for tasks. Since ADHD kids often underestimate how long things take. Planners, a must-have since working memory is often a challenge. Reward charts, to reinforce positive behavior and progress. For older kids and teens, therapists help them develop study strategies, note-taking skills, and better organization for schoolwork. ADHD can make academic tasks overwhelming, but with the right support, they can find systems that work for them. Now here's the real talk. CBT and behavioral therapy take time and effort. Unlike medication, which works instantly, these skills need to be practiced daily. And yes, as a parent, you'll need to be consistent, which isn't always easy when life gets busy. But the payoff, huge. Studies show that behavioral interventions can dramatically improve not just your child's ability to focus and manage emotions, but also your relationship with them. And that's priceless. So if you're feeling frustrated or exhausted, just remember, small changes, practiced consistently, can make a world of difference. If you found this video helpful, please like, subscribe, and share it with other parents who might be struggling. And leave me a comment. What strategies have helped your child with ADHD? Let's support each other on this parenting journey. See you next time on Raising Stars.